There's no way teenagers can suffer spinal disc injuries. Or maybe there is. Watch this video and find out. Hi, I'm Dr. Jeff and welcome to my channel, Never Look Back Pain, where when you get out of neck and back pain due to a spinal disc injury, you praise God and never want to look back to that type of pain again. Again, I'm Dr. Jeff. I'm also the clinic director here at the Midwest Disc Clinic here in Chippewa, Indiana. We specialize in helping disc injury patients recover non-surgically. Today, the big question is this: can young people, teenagers, kids suffer spinal disc injuries? Well, let me tell you a little story. We've got an image right here. This happens to be my son's neck MRI. My son is 14 years old. They always say that the worst car in the shop is the mechanic's shop. Why? Because they're always working on somebody else's car and don't take care of their own car. Well, I have to tell you the truth. I have to tell you that for years I've been taking care of my family's spines by giving them chiropractic adjustments, but I don't always listen and pay attention as much as I should. And for at least the last 9 months or so, my 14-year-old, who just turned 14, who was 13 before January, was having headaches. And they were getting progressively worse. And I would get him a chiropractic adjustment, they would kind of go away, but I noticed, and my wife noticed, he was always kind of moving his neck, and he didn't actually start to respond really well to my adjustments anymore. But I didn't pay really close attention. Why? Because I'm the mechanic and he's the car. And I should have paid closer attention until my wife said to me one day, "You really need to figure this out." So I stopped what I was doing. I paid attention to my son and I asked him a few questions about his headaches. I said, "Do you feel like they come from your neck or just your head?" And he said, "Dad, I feel like they come from my neck and they go up to my head." And then I asked him an important question. I said, "John, do you get these headaches when you cough or sneeze, or do they get worse when you cough or sneeze? And does your neck pain get worse when you cough or sneeze or strain?" He said, "They do." So I then paid deep attention and I put my hands on him, did examination, and I said, "Okay, I think based on your history, it's coming from the neck, it's going to the head. I think you might have some spinal disc injuries." But wait a minute, he's 13 and 14, it's impossible, is what most people think, because we don't think seriously about kids having problems with their spine more than just a little bit of neck pain or discomfort or back pain. But no. There's a stat out there that says that 60% of teenagers can have spinal disc injuries, and I remember that from a seminar I did from a guy named Dr. Cox. And now I said, okay, we need to do an MRI of the brain just to make sure, because he's my son, and we need to do an MRI of your neck. Surely enough, we get the MRI of the brain. It looks all perfect, all clear. We ran some blood work. Everything looks good. But guess what, ladies and gentlemen? This is a bigger version, but if you look right here where the red arrows are at, you're going to see these bubbles, these black bubbles coming out of the back of my son's spine. Those, ladies and gentlemen, are spinal disc herniations with a couple tears in the disc. How does that happen? Well, teenagers, they get thrown around when they're skiing, they get thrown around on tubing, they look down often. This one plays hockey, they're active. Spinal disc injuries can occur in teenagers. And guess what? I developed a technique called the Dose method. My son has been working with our Dose method for 2 weeks and 0 headaches. So when I paid attention to my own son, thank my wife, I paid attention to my own son, discovered spinal disc injuries in his neck causing his headaches. And now 2 weeks into care in our office with our Dose method, and the headaches have gone away. So can teenagers suffer spinal disc injuries? My son is the proof. So if your teenager has neck pain, chronic neck pain, and headaches, and arm numbness, pain or tingling, and low back pain and sciatica, it could be real. They could be suffering from a spinal disc injury, and it is ultra important to get an MRI, which is the gold standard. Thanks to my wife and me paying attention, we now have my son's spinal disc injuries at 14 on the road to recovery with our dose technique. I am also the author of this little book right here, Never Look Back, A Simple Guide to the Cause and Care for Back Pain. I wrote this book because thousands of people every day have neck and back pain due to spinal disc injuries, and they don't know what's going on. Why? Because their doctor doesn't pay attention to them, kind of like I didn't pay attention to my son. But there are several tests that I tell you in this book that should be run immediately, regardless of insurance, and if your doctor's not doing that, you should fire him and find a new doctor. We talk about the 4 ways you unknowingly every day are hurting your back and neck, and the 4 ways to prevent that. I also talk about a technique to help spinal disc injuries heal non-surgically. Again, Never Look Back, Simple Guide to the Cause and Care of Back Pain. It's $21. It'll be the best $21 you ever invested in getting healthy. I'm Dr. Jeff, your non-surgical spinal disc specialist, chiropractic veteran of 21 years, saying have an awesome and blessed pain-free neck and back day.